My name is Prillaman, and I'm an oncologist with Virginia Oncology Associates. When we meet a patient with a new diagnosis of breast cancer here at VOA, we are acutely aware that they are often overwhelmed, scared, sometimes even disbelieving or angry. I think we see it in part as our job to help empower patients, to provide them with information and guidance to help them make the best decisions for their health, and to try to return to them that sense of control that they feel they've lost from their breast cancer diagnosis. When a patient first comes into clinic, they're met by friendly staff members, and they're often escorted into an examination room where they'll sit down with a physician, a medical oncologist, for an extended visit. Now, a medical oncologist is a doctor who cares for patients with a diagnosis of cancer. When I first meet a patient, I want to get to know the patient as a person. I want to know where they're from. I want to know about their family. What was their line of work? What brings them joy in their lives? Because in truth, I'm not treating a cancer, I'm treating an individual. An individual who's surrounded by a network of family and friends who usually deeply care for them. So after I've had an opportunity to get to know the person a bit, we delve into their breast cancer diagnosis. How did they come to find they have breast cancer? We talk about the radiographic studies, the mammogram or the ultrasound. We discuss their experience with the biopsy. We then review the pathology together in detail to help them gain a better understanding so they understand the implications of those findings. We also talk about some additional things. We discuss their personal history of other cancers. We discuss their family history of cancers. And we want to know if they would benefit from genetic counseling or genetic testing, which is also offered at Virginia Oncology Associates. Today, genetic testing results guide not only our recommendations regarding prevention of cancers and screening for cancers, but now even guide some treatment recommendations. So after we've talked about those issues, we then discuss chronic health conditions of the patient. We'll discuss the surgeries that the patient has had in the past. We'll talk about their living situation, their access to health care. How easy would it be for them to get to our clinic and make their way back home? After a brief physical exam, we then set about talking about treatment decisions. Now, often at this first visit, we don't yet have all of the information we need to make a complete recommendation regarding therapy to the patient. Sometimes we're waiting on a surgical pathology specimen. Sometimes we're awaiting a special molecular test that might help guide our recommendations regarding chemotherapy. But what we can do at this visit is review the core therapies that we use to treat breast cancer. We talk about surgery, mastectomy, and lumpectomy and sentinel lymph node biopsy. We touch on radiation therapy. We talk about chemotherapy and hormonal therapy. And now we even have a discussion often about targeted therapies and immunotherapies that help stimulate a patient's immune system to better battle cancer. We discuss with the patient that once we've gathered all of the information, that we meet and confer with other members of the patient's team, the radiation oncologist, the surgeon, and then we come up with a plan that's personalized for the patient. You know, one reason that patients often feel overwhelmed is because there's seemingly a lot of breast cancer experts out there, including their Aunt Lucy and Mrs. Kravitz, who lives down the street, because they all seem to know exactly what the patient needs for treatment of their breast cancer. But in truth, breast cancer isn't just one diagnosis, and what benefits one patient may have no role in the treatment of another patient. On one end of the spectrum, we see patients who have precancerous conditions that we simply monitor. And on the other end of the spectrum, patients may require any and all of the therapies that we touched on. As the visit's coming to an end, we return to that notion of empowering the patient. And we make sure that the patient's questions are completely answered, and we offer up other resources that are available in the community, like support groups. And then, importantly, we create a follow-up plan with the patient as we join them on their journey.